Welcome to GMED chain, a blockchain supply chain solution in the healthcare. The problem is that people lives are at risk because of medical supply shortage and fraud. And this whole system is multi-layered, weak, long, and costly because of the lack of governance, integration, trust, and transparency. Thousands of people die every year because of the essential medical supply and the medication shortage. According to WHO, 200 billion pharma products are sold globally every year are counterfeit, and 10% to 25% of budget caused by corruption and fraud in procurement. So let's watch a video.
Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
Our health system is on the brink of collapse. Thousands of people die every year because of essential medical supply shortages and fraud. With more than 3 million cases of COVID-19 worldwide, hospitals around the world are having difficulty getting safe and quality supplies. Trust in the global medical supply chain is broken, putting millions of people's lives at risk. The current situation is a much broader story. Why? Let's follow a pill. Pills are manufactured and sent to the wholesalers, then sent to distributors, then picked up by logistic partners, cross the ocean, and are redistributed to the distribution center. Finally, they arrive at the hospitals. But there is a problem. Hospitals and manufacturers don't talk to each other. There is no communication, no transparency, and no trust between supply and demand. How do we improve the long and costly supply chain system so more people have timely access to better health services, both in normal and difficult times? GMED Chain is here to revolutionize the healthcare supply chain ecosystem and rebuild trust by connecting hospitals with verified suppliers and logistics partners directly with blockchain technology. We focus on transparency with smart contract, credibility through track and trace capabilities powered by IoT, efficiency through data analytics and machine learning, and privacy through zero knowledge proof.
Let's say the WHO is procuring future COVID vaccines for the country of Nigeria's health system. Our platform facilitates genuine, validated, and intuitive exchange of the supplies and gives insights throughout the vaccine supply chain journey. As a healthcare professional, no matter what your field technology, you may drill down to individual pallets of supply being delivered and learn their location and temperature profile. We integrate with hospital ERP and inventory tracking systems to automate the onboarding and notification process. Global MedChain is helmed by a team of dedicated healthcare industry professionals. It's our world. Together, we can make it better and safer. Global MedChain.
Yeah, just a few slides about our business model. So we are free for buyers and hospitals to use, and a SaaS model, subscription model for sellers, suppliers, and manufacturers. And also we also offer customized enterprise solutions for large entities and the government. And our go-to-market plan is basically leverage partners and network connections and referrals to and B2B sales. So we have a we believe in our solution, and we will use the funding to directly go back to product development and operation, as well as key hiring such as a sales team. That's our timeline. So there. Thanks for listening, and please give us feedback.
I had a question / comment. It's really interesting how you how the team mentioned using zero knowledge proofs for data privacy. Could you go into a bit more detail about how or what data is going to be encrypted, one, and two, whether or not this is supposed to be on, say, a permission chain or a permissionless chain like Ethereum, or a chain that supports, smart contracts and things like that?
Yeah, we are built on Ethereum, and so we give the user a choice. to share the data with the network. So they could also, we encourage them to share the data with the health ecosystem to better predict and plan in the future, but also remain anonymous. So we are using the zero knowledge proof to have them to have the transaction, but it can see by people, but they don't know who they are. I hope that makes sense.
That's helpful, thank you. And another question around the business model. I recall you mentioning that it's going to be free for hospitals and physicians, but you were planning on charging the suppliers. Could you, one, go into more detail about that, and two, since arguably there's a short-term phenomenon where a lot of the suppliers and the brokers are kind of taking advantage of the fact that different states are bidding and there is a lot of information asymmetry between kind of the bid side. How would your team kind of reconcile the potential fear or pushback from the suppliers that this would kind of erode some of their profits? Because if this is all taking place on a marketplace, then the buyers can see, okay, I'm bidding 20% higher than I really should be, and that 20% could be, extra for the supplier. So, like, how would your team kind of reconcile that and adjust your go-to-market strategy?
Our platform really focused on relationship building, especially it is in healthcare. So relationship and partnerships the most important part. And we have to start building the trust between the supply and demand first. And because it's on blockchain, so it's the transparent. So we try to remove and not unnecessary intermediaries to give back the power to the buyers, so they have the option to choose the source. And from the seller's perspective, they because we cut down all the intermediaries, all the middlemen, they actually are able to sell to the hospitals, to the physicians directly, and also reach to at a global level. So they are gaining more revenue and sales that way.
So a couple suggestions for a good idea, good concept. I would separate and distinguish between supplies, so PPE and versus vaccines. Very different models, very different data, entities that participate and capabilities required. I'd also clarify when you talk about B2B versus customers and ZKP, generally we're talking about entities, right? So people fill scripts, but they don't buy PPE, they don't directly buy supplies. So I would just clarify that as you make your presentations and you lay out your thinking to potential consumers.
Okay, thank you.